is the definition of dental caries? Dental caries is a microbial disease of the calcified tissue of the teeth characterized by demineralization of the inorganic portion and destruction of the organic substance of the tooth. Coming to the classification. According to Sturtevant, dental caries can be classified based on the location, extent, and rate of progression. According to the location, dental caries can be classified as primary caries, caries of the pit and fissure origin, caries of enamel smooth surface origin, backward caries, forward caries, residual caries, root surface caries, and secondary caries. According to the extent, it can be classified as incipient caries, cavitated caries. According to the rate of progression, it can be classified as acute caries and chronic caries. To the morphology, it can be classified as occlusal pit and fissure caries and smooth surface caries, root caries, and linear enamel caries. According to the rate of progression, it can be classified as rampant caries, incipient caries, arrested caries, recurrent caries, and xerostomia induced caries. Coming to the GV plaques classification, class 1 can be classified as the caries on the occlusal surface of pits and fissures of the molars, the occlusal two-thirds on the buccal and the lingual surfaces of the molars, the lingual surface of the anterior teeth. Class 2 can be classified as lesion found on the proximal surface of the molars and the premolars. Class 3 can be classified as lesions found on the proximal surface of the anterior teeth which do not involve the incisal angle. Class 4 can be classified as lesions found on the proximal surface of the anterior teeth which is involving the incisal. Class 5 can be classified as the lesion found on the gingival third of the facial and lingual surfaces of the anterior and the posterior teeth. Class 6 classification was given by Simon where it was the lesion on the incisal edge or the cusp tips of the teeth. Coming to the pit and fissure caries, pit and fissure caries is limited to the pits and fissures of the occlusal surface of the molars and the premolars, the buccal pits of the molars and the lingual pits of the maxillary anterior teeth. Clinically, these look as a brown or black in color. They are soft in consistency, and while passing the explorer tip, we can find an appropriate catch. The adjacent enamel looks bluish white in color. Coming to the smooth surface caries. The smooth surface caries develops on the proximal surfaces of the teeth, the gingival third of the buccal and the lingual surface. They are caused due to the plaque formation in these areas. They occur usually below the contact point, and clinically they appear as white, opaque or yellow-brown pigmented areas. The adjacent enamel appears bluish white. Cervical caries. They appear as a crescent-shaped lesion on the cervical aspect of the tooth. They may extend proximally. They have occurred because of the poor oral hygiene. Coming to the backward caries, it's a lateral spread of the carious lesion along the dentino-enamel junction. It can be corresponded to the pit and fissure caries, where if we see a triangle, the larger portion is towards the occlusal, the smaller portion is towards the occlusal aspect, whereas the base of the carious lesion is towards the dentino-enamel junction. Coming to the forward caries is corresponding to the smooth surface carious lesion, where if it's an inverted cone-shaped appearance, the base of the caries is towards the occlusal surface and the tip is towards the dentino-enamel junction. Residual caries. Once we do the cavity preparation, if any caries is left behind, then if we restore the tooth, the caries progression occurs at the dentino-enamel junction and in the enamel wall. Coming to the root surface caries, usually seen in older adults, it initiates at the surface of the mineralized dentin and the cementum, which have greater organic content. They have a rapid clinical course. To the secondary caries, this occurs at the junction of the restoration and the cavo surface margin of the enamel. They may extend beneath the restoration, and it usually happens because of the micro leakage of the restorative material. Coming to The reversible caries lesion, also called as the incipient caries lesion. It is a white spot chalky lesion which is seen on the tooth surface. It is an initial sign of demineralization. Cavitated caries lesion. These are the advanced caries lesion where there is a breakdown on the tooth surface. The remineralization of the tooth is not possible and the treatment is cavity preparation and restoring the tooth. Coming to the rampant caries lesion. The rampant caries lesion usually happens it's usually happens when it involves all the teeth except the mandibular incisors. 10 or more new caries lesion which happens in a year is called as a rampant caries lesion. Next, coming to the arrested caries. The arrested caries usually the caries progression is stagnant or stationary, and the progression of the caries does not happen in such kind of lesions. Both the dentitions are affected. The lesions usually appear as an open space in which the food may get accumulated. The superficial soft layer is softened and decalcified dentine gets burnished and has brown stained polished appearance called as the ebonation of the dentine. Coming to the etiology of caries, there are three theories, that is the early theory, the endogenous theory and the exogenous theory. To the early theories, the legend of worm. According to this theory, it was thought that the caries happened because of the worms. Next came the humoral theory. According to the humoral theory, it was thought that dental caries happened because of the internal action of the acid and the corroding humors. The next came the vital theory, which was told that, according to this theory, the tooth decay originated from the tooth itself. That is like a bone gangrene, where because of the decrease in the blood supply, there was a formation of caries. Coming to the exogenous theory, the theories were chemical or the acid theory. The teeth are destroyed by the acid formed in the oral cavity. The parasitic theory or the septic theory, which told that the microorganisms were the cause for the caries process. The most important theory is the acidogenic theory, which was given by W.B. Miller in the year 1890, which was the most accepted theory. And according to this theory, he explained that there was a formation of acid due to the fermentation of the dietary carbohydrates in the presence of oral bacteria, which led to the decalcification of the tooth structure and dissolution of the organic matter of the tooth. He isolated the microorganisms from his experiment and stated that they were involved in the caries process. Hence, three main important factors in the caries is the dietary carbohydrates, the microorganisms and the acids. The limitation of the theory was that he could not explain the subsurface demineralization. He failed to justify the rampant caries. He did not explain the caries in impacted teeth. The phenomenon of arrested caries was not explained, and smooth caries, surface caries, is not accounted in this. Next came the proteolytic theory, which was given by Gottlieb in the year 1964. According to this theory, it was mainly the dental caries happened because of the proteolytic process. The bacteria present produced a proteolytic hydrolytic enzyme and caused proteolysis, leading to the dissolution of the organic substances. The microorganisms invade the organic substance first. The drawback of the theory was that in the in vitro studies did not prove the proteolytic process of dental caries. The proteolytic bacteria are uncommon in the oral cavity. He did not explain the role of sucrose, the pH and the fluoride in dental caries. The protein content on the enamel is very less, which is 0.6%. So initiation of dental caries by proteolytic process is questionable. Next came the proteolytic chelation theory. So according to this, there is a combination of proteolysis and chelation which takes place. What do you mean by chelation? Chelation is a process which involves the complexing the ions into a substance by covalent bond, which results in a highly stable, poorly dissociated and weakly ionized component called the chelate. The bacterial attack on the enamel is initiated by keratinolytic microorganisms except the citrates and the lactates. The limitation of Thier's theory was that it failed to make a mention of the sugar and the acid production. The scientists proved that chelates are weak and cannot cause decalcification. Schwartz said carbohydrates does not cause acid production but it stimulates. So, according to the recent concept, there are four important factors which is involved in the caries formation. One is the diet, the host, the microorganism, and the time factor in which the food get accumulated on the food surface. So, coming to the individual factors, that is the teeth factor. In the morphology of the teeth, the pits in the fishes are more prone for caries. The tooth which has got an enamel hypoplasia are more prone for dental caries. The tooth with mottled enamel and with the white buccolingual caries teeth. The malpositioned teeth and the rotated teeth are more prone for caries. Coming to the composition, the surface is more resistant to carious lesion compared to the subsurface enamel. The dietary factor, the food what we take, that is the carbohydrate, is a cariogenic diet, and the cariogenicity is based on the physical nature. That is, if we take a sticky food, the food gets accumulated on the tooth surface. It is difficult to clean, and there will be more caries occurring in such kind of a diet. The chemical nature of the diet, the mode of intake, the clearance rate, and the frequency of intake. Next, the plaque and the microorganism. The plaque plays a major role because it harbors the most of the microorganisms which causes dental caries. Now, the plaque contains the salivary component, that is a nuisance. It contains the desquamated epithelial cells, the microorganisms, and the calcium phosphates. Thank you.